Okay, hello everyone. My name is Dr. Shahriar, and I hope so everyone is doing well. And welcome to the seminar for the BIMSSSCON. And this is the program, the first time on the visual media. So I'm very excited about that one. And this is like 2020 to 2020, and we're going to discuss about a very important topic. Which is a very commonly asked question. That is, should I make my career in home or in abroad actually? So for that one, I'm just going to share my slide. I hope so all of you will be liking that one. So here you go. About the slide. So BIMSSSCON, that's 2020, career in home or in abroad. So before I start this session, this is Dr. Shahriar. I'm going to tell you about myself very shortly. But before that, just want to thank, BIMSSSCON for inviting me and giving me this opportunity for this program. All right, so really appreciate that one for inviting me. So, the first slide, which I like to show, in the main, as a main slide today, which I will highlight, especially more are, watching, they are really confused. Is it home or is it abroad? Every day I got so many questions regarding that. So if we see here, a little bit, in this case, so let me just take the pointer. So home or abroad. So let's, make it as a crackdown. And I divided it to home degrees and the abroad degrees. So in the home degrees, as you can see, the very popular one we know in our country, example in Bangladesh, we have the FCPS, we have the MD, MS, the diploma. I divided into the big four. These are the demanding, people know about it very well. And there are some smaller degrees too that's available. Like example, there are like, the CCD course, DSMA course, some of the ultrasound courses, okay, and some of the certificate courses actually, which you can also do actually. And, you can utilize it and it's good actually, the end of the day, the thing that matters, how skilled you are. But of course you also do need degrees actually. And the public demand, parents demand, whatever you can say, the BCS all the time is there actually. Even, no matter, how many degrees I have these days, is still my father sometimes ask you, I wish you could appear in the BCS actually. So so that's why I put it in that way, like public or parents demand in that way. And another, if we just go to the right hand side, and if we can see the big three exams, the PLAB, USMLE, AMC, these three I will tell more today, including the home degrees. And there's some other, degrees too. These are like MCCQE for Canada, press exam for the Ireland, and NZRS for the New Zealand actually. All right, and do understand one thing, I'm talking mostly here about the license exam. If we talk about the post-graduation, the post-graduation degree in UK are like MRCP, MRCS, MRCP-CH. So these are the post-graduation or the fellowship degrees. All right, and if you go to Australia, there are also post-graduation degree like FRACGP or RACGP fellowship. If you go to USA, there are degrees like the fellowship degrees again. After finishing the residency, one thing to understand in USMLE, those doctors are writing the MD. It does not mean they are, fellow or something like that. They just have finished similar like us, the training programs. But to be a consultant, still you need training, and those are called the fellowship degrees. All right, so MRCP, MRCS, those things are for UK, FRCGP for Australia, and for USA, there are also fellowship degrees after this license exam. All right, so let's get going. Let's talk a little bit about myself after giving, these things. So this is myself, Dr. Shahriar Ahmed Sujoy. I'm a breast physician in Australia, and I'm also working as an, one of the chief trainer in, education for health in ICDDRB, as working as international tutor for a couple of years, and also have my own academy and all these things. In early life, I did my FCPS and the diploma thing, and then get into license program and finish this AMC thing and get into Australia. And after that, also been tutoring for a long time. So that's a short introduction. Let's not waste that much time here actually. Let's get into the main program today. I mean, that's the future. I mean, what should be your future actually? And for any inquiries, you can always visit the the BIMSSSCON homepage. Personally, I won't appreciate that much, but if you really need, I mean, confused in that case, you can WhatsApp me. I'll try to answer you back in that case. The next, the very, very important, why do most of the doctors want to migrate? I mean, that can be an interesting question. I would say most cases, what I see, let's start with the female doctors. I mean, the many time they approach it, I mean, they ask, why do you want to migrate? And the very commonly, I mean, the answer is given that, I'm getting married and the fiancé is from Australia, the fiancé is living in UK, fiancé is, so this is one of the way, no offense by the way. So this is one of the first, I mean, thing we see. Secondly, I mean, the ambition, okay, you are really ambitious, you always wanted to work in UK, you always wanted to work in USA or Australia. Another group of doctor, I mean, they have green cards. For example, you heard about the lottery system, or some of, I mean, maybe relative there, applying for you. So you are already the citizen. So you're studying in Bangladeshi medical, so you have to get back to those countries. So for them, again, they have to go, so no chance. I mean, you don't have other options. And as I said, the ambitious people, and some cases, and nowadays, I mean, one of the very, very, I would say, important point, they are not, I mean, many of the doctors are not that happy. I mean, maybe the doctors' rights and things are not that reserved, I mean, in this subcontinent. It's not only about Bangladesh. I mean, if I see India, Pakistan, nearby, Nepal, so the salary, this is one of the important thing. Of course, we doctors, we work hard. Everyone works hard, but it's like not only working hard, there are a lot of study things. I mean, during our MBBS, during internship, even after that. So I believe in that way, we deserve a bit more, I mean, in that case. And in every country, if you go, the doctors earn a bit more. But when we see, let's take example in Bangladesh, the salary is still not improving for the doctors. I mean, yes, a certain group of doctors might be earning a lot, but it's still the junior doctors. So this is another reason, I guess, that doctors want to migrate actually. And of course, the frustration and all this thing, early life success, our FCPS actually takes us so long time. Yes, there are some doctors there can pass in 5-6 years. There are like 4-year or 5-year training out there, but some doctors lucky enough get passed. But if I take the average, like 10 years, 12 years it take, but when someone is taking the MC route, PLAB route, they're quickly getting into the country and they start earning like same, a very big handy amount actually. So let's go. I mean, let's talk about the home country degrees. We should not ignore the home, because most of you are going to have career in home countries actually. So let's not ignore that one. I did myself in the early life. I did that one. Later I switch over. That's a different thing. But still, I mean, so what are the plans? What are the degrees that's available? So if we see here, I mean, I divided into the left hand side, that's the home country, and the right hand side, the abroad degrees. So in the home country degrees, the big four, I mean, if you can see the big four, what are the big four? Like the very, very big one, FCPS, MD, MS, diploma, MPhil. So these are the degrees, and the BCS, which I told earlier, and the smaller ones are this actually, and this one, the abroad one. All right, so I'll go for more crackdown now. So home or the abroad, I mean, today's topic, and home degree. So if we talk about the FCPS and MD, what are the basic differences? So I will ask, I mean, to my audience, do you have an idea? So I'm giving you 15 seconds time. If you're a 5th year, like, do you know the differences? Ask yourself, like, do you know the differences, basic differences? I mean, what's the time of the exam? Where the exam is held? What is the syllabus? So these, is it a multiple choice question, or is it the true false? So these, all the questions are in the young mind. So let's get and see these things. So starting with the FCPS, that is held in 2 times, I mean, in year, the January and the July, every year. That's, I mean, during COVID, by the way, we all are affected by the COVID and all this thing. So many doctors are dead. Let's pray for them, and let's continue this slide. So yearly 2 times, like, January and July, and this time it's affected. FCPS exam was affected as well, actually, because of that. But usually it's 2 times, January and the July. Okay, so it's under the BCPS, which is in the Mohakali. I mean, I hope so you know the place. And a very commonly asked question, it came that, can I appear during internship? No, you can't. Okay, so and syllabus, I mean, the clinical would be more than the basic. Now, there must be some reason why I put that one here, because if you see in MD, MS exam, there's the basic subjects are more, I mean, compared to the others. So basic is more there actually. And some of the popular, I mean, you have the option to choose. I mean, you want to be, I mean, a specialist in internal medicine, you want to be a specialist in cardiology, or you want to be a specialist in physical medicine, rheumatology, so many, but some are, very, very, I mean, popular, more competitive. So those are like, I would say, internal medicine, general surgery, the typical gynae obs, and the pediatrics. I mean, these are some of the demanding actually. We see a lot of more competition in the internal medicine every year. I mean, compared to the others, surgery as well, I would say. So these are the more popular, and you need at least 70% in each subject. So you can see one day FCPS exam is held in 3 days, and this MDMS, these exams are held in 1 day. I mean, this is a basic difference. So this 3-day paper, I mean, that has been done, and you have to get the 70%, I mean, in each of those subjects actually. And the system, I mean, when we were appearing, long back, that time it was true, false, and show, the short answer question, like the single based or multiple choice, was just beginning to appear. So in my exam, I got 10%, but now it's increasing. Then it came to 30, and now I heard it's went up to 50%. And now we strongly believe, and there will be a time, it will be totally overtaken. I mean, all things would be multiple choice, because if you see the MRCP exam, which is a bit similar with the FCPS, I mean, they have, I mean, all the questions are, the single based. So single based is the ultimate goal, you can see here. And here's the website, all the information about the FCPS, this is their official website. So you can just go and just type and please figure it out actually. Sometimes doing own research is very, very important. Like not always, you're just going for seminar, this, that, you also need to do your own research. So since I'm giving you a website, you should at least go and, you can pause me, I mean, when you will be watching me later. So then you can just open up this website. Now, next, like if you see the MDMS, yearly again the 2 times, but the main exam is in around the March actually. All right, and there is a BSMME one separately. So there is like MDMS, again internal medicine, then general surgery, ortho, cardio. So these are, I mean, some of the more demanding ones actually. Now, some of the diplomas are also, I mean, popular. Diploma is just 2 years, but still you can be a consultant and you can also earn a lot of money at the same time. So some people took also shortcut with the diplomas. Like, see, diploma actually, if it's like a 2 year, you can finish it in 3 years. Maybe your status is not high as FCPS, but you don't have to struggle like for 10 years for that one, because life, I mean, in the first 10 years is more nice than, compared to after 40 or 50, right? So the system, I mean, in this, MD and MS is like, the true or false. Okay, so true, false. So there's a basic difference in this one and in this one. Now, if we come in this part, I mean, if we see and zoom here a little bit, in that case, if we see like some of the additional degrees, like the CCD, certified course in diabetes, many doctors do that, and they are practicing quite successfully in not only in the periphery, but also in the Dhaka. So it's a very, very good degree, I would say. I mean, small, but effective. That's all I can say. Then D-asthma course by Bangladesh Primary Care Respiratory, I mean, the physicians. So they are like also running this one. I mean, the BPCRS, that one, .org. You can also go to this website and, find out the upcoming courses and all this thing. Then the C-boot, you can also check their website and, find out. These degrees are also useful in country. These degrees are also useful when you go abroad, actually. So my suggestion, if you ask me as a career expert, you should do these things. And good thing, which I add here, like, you can do it during your internship. I repeat, so this is one thing which you can do during your internship. These particular things you cannot do during your internship. I mean, you cannot appear, you can prepare, but you cannot appear during your internship, actually. All right, so this is the slide, I mean, which I prepared to differentiate between the last slide we saw, like the home degree. So I just try to crack down a little bit for you guys, like, the degrees, I mean, this related to home countries. Actually, there could be miscellaneous thing. There are some degrees I have seen on the skin. There are some, so all these things are under certified courses, actually. All right, so next one, I mean, we are going is the next slide. I mean, time is really, really short actually. And nowadays everyone wants shortcut and all this thing. Everyone is in hurry. Everyone have to earn a lot of money and all this thing. So anyways, I mean, fair enough. I mean, there's no problem in getting success in early life then. Okay, so concepts are changing, for the young generation. So as an expert session during internship, whatever, so do your job well, first of all. So some doctors get too involved that they even don't do their internship well. This is a very wrong practice, believe me, and you will be caught at certain point. I mean, if you're planning abroad and if you're not doing the internship properly, like some of the procedures and those things, someday, somewhere you will be caught, believe me. Then starting, you can always start the preparation. So simultaneously you can definitely do that. Very, very important, you have a routine. I mean, it can be 3 days. I mean, example, if it's 3 days, it has to be always if it's 3 hour, it always, has to be like 3 hour during internship, since you get less time. If it's 4 hour every day, then it's also 4 hour. So please make sure you have a good routine. Okay, so do short courses, which I told earlier. These courses, those short courses, you can always do actually. All right, and read question banks. I know, see what we learned in our MBBS life. Okay, this is the theory, and we go for item, card, terms, and like prof eventually. But the question bank we really don't study. But when you come to the competitive exam, no matter FCPS, MD, no matter you go USMLE, PLAB, AMC, you need to solve a lot of question bank, and you should have a very good grip in that case. All right, so Nilkhet should be your hub. I used to go to Nilkhet, all the time. Any new books came up, so they can always give you some more information, like compare and contrast. One thing I have to say, like, see, like, in the word, if you are just thinking your professor will always be teaching you, it's totally incorrect. To be honest, our senior brothers, our immediate registered, they taught us a lot of things. Similarly, do not ignore the nurses. You can also learn. I learned my first NG tube and all this thing from a nurse. Alright, so it's the same thing, when you go to the Nilkhet and the thing, do not ignore them, treat them also human being, which books are trending, what are the other books. So they also are very cooperative. All right, so you should also go to the book centers and the things. You should ask which books are useful and all these things. So you'll get more ideas. Okay, nowadays these are blazing, and all these things they're arranging a lot of videos in the YouTube. But previously, if you go, there was nothing like that. All right, so, and I hope so you can remember the typical modem. It's only was used for sending the email. There is no YouTube, nothing. It's not possible. And even if you accidentally open a YouTube video, the whole data is gone. For that month. But anyways, like, so, and different Facebook forum. At the end of this session, I'll give you some forum links where you will get all the books free. All right. Now, one more thing before I left this slide, you must collect your MSP. Now, what is MSP? Google it, please. Like MSP, transcript of medical colleges, and transcript of DEU. Like, say you are going for PhD. Many doctors are going for MSc. Many doctors are going for PhD as well. Many are going for MPH as well. So if you're going in abroad, you definitely need MSP. Depends on the degree. Like, if someone is going for USMLE, they definitely need MSP. Then transcript of medical college, of course. And if you're going for PhD, you also need the transcript of DEU. Now, for this one, you also need your medical degrees, the mark sheets you have. Okay, so your mark sheets and all this thing, you also need to get the transcript from the Dhaka University. Right, so these are the important thing. And your MBBS degrees, which is also very, very important, which is also given under Dhaka University. So that one is also very important to appear in the competitive exams, right? In our country, mostly they get this certificate, of the MBBS certificate during convocation. And this is a fun part, actually. A funny slide, I would say. In this one, yes, this is something we call it Delhi's Laddu or whatever. Those will eat, they are happy. They are not eating, they are also, happy. Like, anyways, the thing, there's also a truth for the female. Most cases, they usually don't get that much time to choose, but things are changing as well. So there is no right time. We also get question regarding that. The answer is when it's right, actually. Okay, it's depend on partner and a lot of other things. All right, so when it's right actually. So do not hesitate on doing that. But do understand one thing: your career is also very, very important. Actually, like example, if you're having an upcoming exam, say FCPS exam, and just before that, I mean 3-4 months back, if do not get married that time. Make a proper plan. That's most important. All right. After internship, that's high time. Internship is also high time. After internship is even more high time. But the most important thing that it should be, I'm talking from the experience, many students I deal all the time around the year, for around 40 to 100 students I have dealt so far. So from those experience, I'm telling you that by this time you should be actually deciding, am I going to abroad and am I staying in the country? It should not be a dilemma that, okay, let's see, let's just start studying PLAB, let's just studying MC, or let's just start studying FCPs and later we'll think about the abroad. You are not going to get success actually, because the time will be passing. It's not right actually. All right, so by this time please decide, whether you're going abroad or you are staying at home. And you really have to, no matter what exam, you have to hold on for 2 to 3 years actually, right? So this is very, very important. Now, very, very important. One thing I always tell my students, like pain is temporary, but glory is permanent actually. So no matter what happened in this 2 year or 3 year, you really, really need to work really hard actually. This is so important. Believe me, your life will be totally different. Otherwise you will regret. I saw many depressed students, they tell, okay, I wish I could have done, now things are not in favorable and the thing. That's the thing, but they also do get time 2-3 years in their early life. Okay, many get pregnant later, and it's become tough actually when there's more members in the family, and the thing, they migrated in abroad. There is no, the we say kajer bua, or the the working woman and the thing, working at your home. So you'll be, you have to do all your work, which is not a bad thing, but you will, there'll be a lot of time will be cut. Believe me, when you are at your home, your mom is coming with a tea, taking care of you, that okay, how's your study and this thing. When you go abroad, no one is going to ask you those things actually. So good side, bad side, all these things are there, but you have to, just keep going. That's most important. You cannot afford to, we doctors can afford to be sad in this field actually, right? It's like Terminator. You have to be robots and things like that. We do have emotion, but you have to control it at a certain point. Let's check some of the, let's forget about the, I'm talking about a few depressive things, even COVID is going on. Now some license exam, and very, very important one, and very, very attractive one actually. Now, a very popular slide, which I have actually, let's try to, break it down, with some of the interesting points. So let me take my, this pen. Now, starting with, all these three big exams. So these are the, three main exams where all the doctors actually tried, so far. So 90%, worldwide, they try for these particular exams actually. So these big three, I would say. So let's start with the PLAB. Why PLAB, I would say, is one of the most popular exam. So it's one of the reason is it is budget friendly. Now, how many times you have gone through Emirates, and how many times you have gone through the Malindo Airlines or Bangladesh Biman? So obvious reason, it's not, unless someone has a big money tank, that's a different thing, but otherwise the local flights are being taken. So the same thing. So I'm not criticizing, but of course, it's quite the budget friendly. So AMC, technically, is quite expensive. USMLE also expensive, because another reason for it's so many steps, almost like 4 steps for USMLE. Why 4 step, I will tell you in that one shortly. And MC individual exams are also expensive. All right. So these are the points. So PLAB wins here. Being the most, reasonable exam. Actually, cheaper. Not the best word. Reasonable exam actually. Now salary. Now the same thing. The how you will pay and the how you will get actually. My nana, he passed away last year, used to say joto gur toto mitha. It means, the more the, the sugar you will put in, more it will be tasty. It's like that actually. The same thing. So the more you are investing, things will come up like this. So the salary structure, to be honest, I have done a lot of research, is actually a bit low. Okay, compared to, so many doctors can also earn the same money, maybe nearby, even in country actually. All right. So, but the good part, it will get gradually increasing. So this is the good part. I mean, so initially do not expect that much, but it's the same thing if you go in AMC, it's huge difference with the PLAB. So the salary and these things are much, much higher. Whereas a PLAB doctor in the beginning is earning 2,500 pounds, you know, which is like a, I would say 3,000, US dollar, whereas in doctor in Australia, they earn around like 8,000 US dollar. I would say at least like 7,000 US dollar, I mean, per month actually. All right, it's same like the US and in USA is also similar actually. It's quite a high actually. Now, job facility, I mean, in UK now it is of course a bit more. I mean, in Australia it was as like before. Okay, now after COVID, every country's things are more demanding for the health professional. One thing, I mean, sometimes one thing that is happened good for one group of people but become bad for one group of people. So the COVID thing, it was bad, I mean very bad enough for a lot of people, but for the health professionals, I mean temporarily it's looking bad, but when we think about the scopes, I mean the scopes are increasing for the public health, researchers. Big fields are coming as like example, too much demand for the virologist nowadays, too much demand for global health, too much things for epidemiologists. No, these are booming up now. The same goes with the doctor. Like, see, in Australia, they, after having the COVID, they announced that they are going to open up so many ICUs. I mean, in near future, actually, they already do have a lot, but they're going to open up so many in coming future. All right, so that means they need also more doctors actually. So the plan, of course, a big country, I mean, big number of people, so more number of jobs. Australia, it's remained the same actually, but due to COVID, it's booming up. The USA, I would say, again, due to COVID, it's booming up actually now. All right, matching issues. There is no such matching issues like we in PLAB or in MC. Whenever you are ready, you pass the exam, you keep applying. But in USMLE, there's a different system. It's called the matching. Okay, so you have to wait till you get matched. Your score, your lot of CV, your poster, a lot of, there's a big list, I mean, out there. So which the checklist they will check, I mean, whether you get matched. Do understand one thing, if someone is a citizen of US, they, of course, they will get more, they will give more priority on giving the job. I say, which is fair enough, I guess. Now, quality of life, I would say good. I mean, in UK, I mean, all these countries are good. When we, I mean, I'm not telling bad about the countries, but sometimes, there's like, if you see the roads are very clean in those countries. So, suddenly you will feel the differences actually. So the quality of life is good, I would say, because in Australia, the 4 cities are in the top 10 list. So in that sense, I just say, it's excellent. USA, of course, is a universal country. I mean, one of the richest and biggest countries. So it's, of course, good actually. So visa rejection is, I would say, less compared to the others. I mean, some will tell, oh, what you're saying, PLAB visa rejection. So same less in Australia, but visa rejection are a bit more after, I mean, the very popular person, the popular, my dear person, Mr. Trump has came over, and after that, I mean, the rejection thing has increased actually, but hopefully in coming days, it will be changed. All right. So part of the exam 2, PLAB 1, PLAB 2, AMC, AMC 1, AMC 2. By the way, after AMC 1, you can also manage job under limited registration. There's a registration process. So if you have more than 3 years of experience, it's possible to get job actually. And later you can do AMC 2. I mean, this is only one thing that is, I mean, out of this exam with AMC, it's only available. And USMLE, I mean, why I said 4 parts, step 1, step 2, step 2 CS. After step 2 CS, you can apply for job or the residency or the matching thing. Later, you have to clear the step 3 again. All right, so these are the points. Popular, of course, PLAB is most popular exam, wonderful. USA, it used to be, but since I made this slide in Thursday, but its graph is going a little down, what I felt actually. So if the popularity thing came, it's PLAB actually. Okay, first jobs takes time. I mean, this is one good thing about the PLAB. The first job takes less time. So first job takes average time or more time, I would say, in case of also Australia. I would say average or more time in case of USA as well, actually. USA, I would say the most complex one, because a lot of things they check actually. All right, next, entry to training, not direct. So direct, you can enter into the training programs, right? Working hour, I mean, in case of, I won't say less. Now it has been changed. They have increased the working hour a bit, increasing. Working hour is okay here. I mean, less I would say. Here is also more. So in case of UK, I mean, the money they're giving, but working hour is nowadays they're saying that it's like almost like 10 hours. I mean, per day on average that's been coming. All right. So whereas in Australia it's like 8 hours. It's been like that. But in US, it's even more actually. It's more than 12 hours, right? So it's a big difference. Validity after the part one, there is a time. This is a very big part for the medical student, and also many consultants sometimes ask me this thing. Like if I want to give an exam, suddenly the thought came up in their mind. Okay, let's go for an exam. Very big, because they're financially stable. So still, the heart is always wanting more degree. So the validity after part one, there is a time limit of 2 years. If you don't pass the PLAB 2 after within 2 years, within like 4 attempts, it's tough to get 4 attempts. I mean, to be honest, in 2 years, like let's say 3 attempts. So the time limit is like a 2 year. The PLAB 1 will be cancelled. The good thing about AMC in this case, there is no time limit like that. Nothing like also USMLE in that way. All right. Okay, USMLE there is time. Sorry, USMLE also there is time limit. So no time limit. So if you pass the MC1, you can always apply in future. This is a good part. Now, say example, you are a junior doctor, you pass the MC1. Now you don't have that experience to apply for Australia. So in that case, you can apply in future. So that's the thing. Experience that matters. I mean, less matters. They don't bother. Not at all. I mean, matter in case of USA. I mean, they don't want to see any experiences, to be honest. But in case of Australia, they want the cream sometime actually. So I mean, if you have some experience like 2 years, it will be very, very good. If you're planning for Australia. Okay. So easy to pass. I mean, that's a controversial question. It depends on the people actually. Some people will make easy exam tough and tough exam easy. That's different. So, but since I deal with all these 3 exams, so I would say PLAB is a bit easier. When I see and module the questions of PLAB, I felt it's more easier compared to AMC or USMLE. So a bit easy question system. All right. And free materials. Okay, I have also forum. You can go and download all the necessary things I've put there. So you can go and just download those things. Then there is, of course, the main platform. You can also go there and download the thing. All right. Then for the AMC shares, AMC guide, again a free group. All books, I mean, recalls things are given there. So those ones to study now or later, you can go and download it at least. And also there's a group like AMEDEX. All right. So that's another one. Another one is USMLE forum. Do understand one thing, not all the forums are visible actually. So when you search, not all the forums might be visible actually. Okay, my ones are visible at least, but some of the main platform, like it is not visible to regular. So your friend has to add you first actually there. Same goes with the AMEDEX, your friend has to add you first there actually. Same goes with the one of the main USMLE forum. You will not find it in regular chatting actually. So these are some of the stepwise or the country wise, the popular exam and their differentiating thing. Okay, so I'll give you 10 seconds to think which part. And you can also always inquire me. Is the WhatsApp given, but do understand, do you do the researches before comment? Some doctor has a habit, they don't want to do the research, they just quickly always messaging actually. So sometimes it's good if you do the research and get off your own, but if you're not actually finding it, then we are there to help you actually. All right. Now, I won't take that much time, and as we can see, the books and all these things, these all are the USMLE related book. Very, very nice, precise books out there. Like I always suggest the 5th year, one book to study, that's Master the Board. Very popular book. All right, so you can always study that one. Very nice book. Emergency medicine boards. You should read these books. Very nice books. It will be useful for PLAB. It will be useful for, all these competitive exams. Basic difference with USMLE step 1 with the AMC1 and PLAB 1. Understand one thing, PLAB 1 and AMC1 are kind of similar. USMLE step 1 is different. Why? In USMLE step 1, all basic subjects are there. That means again you have to study pathology, again you have to study physio, patho, biology, the biochemistry, and very advanced level actually. So sometimes some people give up in USMLE because of that actually, because in the first year our study system and their study system is quite different. By the time we start understanding the thing, the time passed away the first prof. Anyways, So, I mean, let's talk about a little bit of the main books. A quick suggestion. I mean, I'll give you three or four very quick tips. You guys start with Kaplan series. So this is one thing, the Kaplan series you guys should starting with. Then the things are coming that USMLE, I mean, sorry, the first aid series, the first aid, every year they release first aid, now first aid 2020, very precise book. So all the Kaplan 8-book series there, I mean, put into the first aid actually. So USMLE step 1 has their own, 2 has their own. So, and then you have to go through a question bank. Okay, question bank, you know, time mode practice, if you can do, it's much better for you. So you have to practice question. Out of them, USMLE world is best. So this is the basic, you know, there are a lot of other websites and the thing, but these are the base, everyone follows this for USMLE. So this is the three main thing for USMLE. Next coming is the plan. The same thing, like see, theory, question solving, mock, I mean, at this end also the recalls actually is given. So the theory you can prepare from the main books are like Oxford, then Kaplan you can see as well. Kaplan is a universal book for all the exams actually. So Oxford, Samson, Kaplan, few things you can also see. And some of the question solving like 1700 band, Plabable, so these are the popular ones actually. And also there are some mock tests, those are available. And of course, a lot of recall things are available. You need to, so every exam you go, AMC, PLAB, maybe just for USMLE it's less, like MRCP, any other exam, they do solve a lot of recall. Recall means past paper. You definitely have to do it. Even for FCPS, they also do past papers. So it is a universal thing. Okay, so this is for the PLAB. And lastly coming is the AMC actually. So these are the popular books for Australian Medical Council exam. And as you can see everyone, so these are the book list for the AMC. And let me tell you how to start preparing. Again, the same thing I'm going to tell you, the 3 or 4 main, I mean, stuffs for this will be starting with the John Muttag, that's the main hub, main book, now currently 7th edition. Then there is a, I mean, MCQ, MC handbook. There's another MCQ book you have to do. Then there's a bunch of other books like Kaplan and blah, blah, the listed you can see. One of the main question bank is the AMCQ bank. It's available in Nilkhet market and all this thing. And also Amedex bank is another bank that is available, right? And again, the same thing, you have to practice a lot of mocks and all these things actually. So these are the, again, the plans for the AMC. All right, and of course you have to do a lot of recall. Recall is the highest number you have to do for AMC than any other exam. Okay, so almost like 2 years to 3 years of recall you have to do, I mean, before going to exam, right? Apart from the theory. So theory is a different preparation, recall is a different preparation. All right, so these are the in general things. So we are almost about to come to an end of our slide. I wanted to talk, but I mean, time and the thing, and it's very tough for people to also concentrate too many things, and all the exam I'm trying to put, I mean, and I'm really sorry, you know, if the things and didn't go, I mean, well for you, I mean, but if you need more information, feel free to contact me in that case, no problem. One thing, you can change your luck only by working hard. There is no shortcut in the medical field. What I learned, I mean, after staying in this field for teaching, then as a clinician, as in doing research, I mean, all I learned, there is no shortcut actually. You know, there's no way you can get lucky. So do your planning, plotting, and start executing from now. That's very, very important. So this is Dr. Shahriar. I mean, all the best to dear doctors. I mean, best of luck and have a very good day and have a very good life. Thank you. Have a great day.